In continuing the discussion of body protective natural properties of such natural substances as nanosilver, naturally sourced germanium, the natural sugar xylitol, improved vitamin C, the tripeptide glutathione, the amino acid lysine, garlic, mycoferron, medicinal mushrooms, echinacea, golden seal, zinc lozenges, olive leaf extract, elderberry, grapeseed extract, onions, Chinese horseradish, royal jelly, ginger, astragalus, turmeric, and apple cider vinegar. There are other natural healthful substances readily available for our health maintenance use. Researched extensively, tea tree is distinct because its properties include fighting 3 separate infection causes. In her book, Aromatherapy A through Z, Patricia Davis writes, tea tree oil is antiviral, antifungal, and antibacterial. Tea tree oil also stimulates the body's immune system, a useful property for fighting disease and infection. Undiluted tea tree oil can be safely applied directly to the skin because it does not irritate the skin. As an antibacterial, essential lavender oil properties include promoting cell regeneration and reducing stress. The complete book of essential oils and aromatherapy by Valerie Warwood highlights lavender's positive effect on cuts. Lavender works as an antiseptic while also stimulating the cells to heal quickly. Jean Rose, author of 375 Essential Oils and Hydrosols, recommends utilizing lavender's stress-reducing properties by using a diffuser to vaporize and spread the lavender throughout the air. Essential lemon oil's properties include promoting physical and emotional health. Lemon oil powerfully affects mental states. Joni Kim and Rob Bull write in their book, Daily Aromatherapy, that essential lemon oil promotes mental clarity, objectivity, and greater focus, all positive properties. Its physical properties include aiding in stopping bleeding, killing bacteria, and stimulating the body's natural immune response to help more effectively fight infections. In looking at mental clarity, it is interesting to note that Michelle S. Borgios, speech pathology professor at Ohio State University, has identified a better way to communicate with people who have dementia by utilizing memory flashcards, for the demented need help remembering. This kind of stimuli approach focuses on what the demented can do rather than what they have lost. Caregivers such as John Zeisel, president of Heartstone Alzheimer Care Limited, are presently utilizing it, holding that these patients are still who they once were and not some new, unidentifiable stranger. These stimuli can be in the form of photos, memory books, and even sentences, helping people with memory problems, including Alzheimer patients, recall past events. Alzheimer's disease, which affects approximately 5.3 million Americans, first strikes the hippocampus, the part of the brain that is critical for learning and memory processes. Typically, long-term memory and certain types of skills like reading, which is overlearned so it is virtually automatic, are less afflicted. This is even extended to advanced stages of dementia where the victim cannot even speak, but they can still read if the words are large enough. This can be observed by their smiles, pleasant sounds, and stroking of photos of loved ones, especially when accompanied by captions. In contrast, spoken words go in one ear and out the other, for they can't store the memory. This is why they ask the same question again and again. This can be easily resolved by writing the answer on a notepad and kindly asking them to read it. This technique can be also used to help resolve anger and anxiety in dementia patients. One example is where a patient refuses to take a shower. Once the nurse's aide showed the patient a card that read, "Showers make me feel fresh and clean," the patient agreed to shower. Using these techniques as modified questionnaires, Professor Borgios seems to be dispelling the notion that Alzheimer patients are miserable. She states, quote, We find that if caregivers aren't stressed and in a hurry, and if the patient is well cared for, and if they feel safe and in a good environment, they think their lives are good. End of quote. The brain and other body systems are heavily dependent on a healthy digestive system, and there are many natural substances that by boosting digestion yield significant health benefits. Out of the many publications on coconut oil, here is a summary of benefits that should allow you to evaluate healthful utilization of this tasty oil. Supports killing viruses that cause influenza, herpes, measles, hepatitis C, SARS, AIDS, and other illnesses. Supports killing bacteria that cause ulcers, throat infections, urinary tract infections, gum disease in cavities, pneumonia, and gonorrhea, and other diseases. Supports killing fungi and yeasts that cause candidiasis, ringworm, athlete's foot, thrush, diaper rash, and other infections. Expels or kills tapeworms, lice, giardia, and other parasites. Provides a nutritional source of quick energy. Boosts energy and endurance, enhancing physical and athletic performance. Improve digestion and absorption of other nutrients, including vitamins, minerals, and amino acids. Improves insulin secretion and utilization of blood glucose. Relieves stress on pancreas and enzymatic systems of the body. Reduces symptoms associated with pancreatitis. Helps relieve symptoms and reduces health risks associated with diabetes. Reduces problems associated with malabsorption syndrome and cystic fibrosis. Improves calcium and magnesium absorption and supports the development of strong bones and teeth. Helps protect against osteoporosis. Helps relieve symptoms associated with gallbladder disease. Relieves symptoms associated with Crohn's disease, ulcerative colitis, and stomach ulcers. Improves digestion and bowel function. Relieves pain and irritation caused by hemorrhoids. Has a positive effect on inflammation. Supports tissue healing and repair. Supports and aids immune system function. Helps protect the body from breast, colon, and other cancers. Is heart healthy, improves cholesterol ratio, reducing risk of heart disease. Protects arteries from injury that causes atherosclerosis and thus protects against heart disease. Helps prevent periodontal disease and tooth decay. Functions as a protective antioxidant. Helps to protect the body from harmful free radicals that promote premature aging and degenerative diseases. Does not deplete the body's antioxidant reserves like other oils do. Improves utilization of essential fatty acids and protects them from oxidation. Helps relieve symptoms associated with chronic fatigue syndrome. Relieves symptoms associated with benign prostatic hyperplasia or prostatic enlargement. Reduces epileptic seizures. Helps protect against kidney disease and bladder infections. Has a positive influence on dissolving kidney stones.